It's all we have.
Hello, it's another fortnight, and once again, the One Health podcast comes to you. I am Sapon Kumankuma. Today we are discussing a very interesting topic, and the guest is also a person after my own heart. So with me to discuss zoonosis or zoonotic diseases is Agboli Camilus Joachim. My brother, you are welcome.
Thank you very much.
Weasel.
Yo.
So, Joachim happens to be the vice president of the Ghana Veterinary Medical Students Association, University of Ghana chapter. It's a privilege to have him here. So, to begin with, what is zoonosis or zoonotic diseases? What are they?
Okay, so zoonosis or zoonotic diseases are infectious diseases that are naturally shared or transmitted between animals and humans. So it has two sides. They can be transmitted from humans to animals. So example is tuberculosis and as well as methicillin-resistant staphylococcus. So staphylococcus. So these are diseases that are basically transmitted from humans to animals. So that's one aspect of it. And it can also be the other way around, where we get the disease humans, we get the disease from the animals. So examples of this one are, so we have the rabies, brucellosis, and anthrax, and many more. So these are basically the term zoonosis means. And these diseases have been with man from ages. And even in the Bible, you recall that the Israelites were admonished not to take any animal that has died of itself.
Yeah.
So yes, basically it's all about anthrax. Anthrax from a dead animal. When an animal dies from anthrax, and when you take when a human takes or any other animal takes the carcass, you are susceptible to getting the disease. So it's not surprising that they were admonished.
That was God using preventive measures.
Yes.
How much for we humans?
Exactly. So these diseases have been with us. But then the term zoonosis actually was coined by Rudolf Virchow in the 19th century. So as I said, they have been with us since time immemorial, so to say. But then the term zoonosis actually was coined by Rudolf Virchow in the 19th century. So that's basically about zoonosis.
So in your definition, you mentioned infectious diseases. So what do you mean by infectious diseases? Okay,
so infectious diseases are diseases that are gotten from or that originates from infectious agents like microorganisms. So we have the viruses, bacteria, fungi, and others that cause these diseases. So we have other diseases that man can get from animals and the other way around. But then for a disease to be zoonotic, it has to be caused by an infectious agent. That is, we have the viruses, as I said earlier, the bacteria and the fungi and others. So that's about the infectious agents playing their role in zoonotic disease.
Yeah, so clearly, aside the germs, the viruses, the bacteria, and the rest, there are other ways human beings can get ill by associating with animals. Can you tell us more about these?
Certainly. So we have snake venoms.
Okay.
Yeah, humans get disease from snake bites. So, but they are not zoonotic. And we have and one that occurs sporadically in our country. You hear in the news about people dying taking pufferfish or the pufferfish poison.
Pufferfish poison.
Exactly. We get it from the pufferfish, from taking the pufferfish, but then it is not zoonotic because it's not an infectious agent. It's a poison. So.
Okay. So you told us about that means we can get this disease by eating animals.
Yes.
Are there other means by which one can get zoonotic diseases, ways by which they are transmitted?
Okay, so as I said earlier, you can get it from taking or ingesting these animals. So that is more about the direct mode of transmission. So we have the direct and indirect. So for the direct, we have the ingestion, we have transmission through fomites, direct contact with the animal, and that's where we have, let's say, a bite from an infected animal. So we can get it, and as well as inhalational. So spores, in the case of anthrax, when you inhale the spores, you are susceptible to getting the disease. So that's about the direct. And indirect leads to you can get zoonotic diseases. So we have a vector transmitting the disease from the human or the man to the animal, or the other way around. So you can have, let's say, an invertebrate, to be specific, transmitted the disease. So we have, let's say, the tsetse fly in the transmission of trypanosomosis, that's the sleeping sickness. Yes, and the tick in the transmission of babesiosis. So that's the two main ways of acquiring the zoonotic diseases.
So that's what paints a picture that we are all at risk, and we are all at risk in a way. Yes. But tell me, who are at risk?
Okay, so yes, as you rightly said, almost everyone is at risk of getting zoonotic diseases. But then we have people that have high risks by their association with animals. So we have the veterinarians, we have farmers who keep animals, and abattoir workers. And basically anyone who deals with animal products. Because, for example, let's say those who make drums. Using the skin of animals. So for anthrax, you can get it through the skin of the animal, so from the spores. So almost everyone is at risk of getting zoonotic diseases. So, and one thing about in our world today, because of urbanization, we are reducing the contact, or we are closing in the gap on the contact from man to animals. Wildlife, they are known to be a large reservoir of some of these diseases. So where we go, urbanization, clear
we are moving
forest,
closer and closer.
Yes, and in our country today, galamsey, going into the forest and everything. So we are moving closer to these animals, predisposing us to getting zoonotic diseases. So almost everyone is at risk of getting zoonotic disease, but those at high risk are those in close contact with animals.
So if I decide to stay away from animals and not even eat animal products and be a strict vegetarian, am I still at risk?
Oh yes, you are. You are at risk of getting a zoonotic disease. So yes, one way you can get it is, let's say, by utensils, and even some of these infectious agents, the animals shared the infectious agents in the environment, contaminating the crops, the vegetables and other things. So when you go, you take this to prepare your salad or whatever it is that you take, you are at risk of getting the disease. So everyone is at risk of getting zoonotic disease. And in our world today, COVID virus. Whether you are a vegetarian, a vegan or not, you are still at risk of getting the COVID virus. And it is zoonotic. It has been found to originate from reptiles. But then, and one thing about that to say is that theoretically reptiles are not actually susceptible to coronavirus, so viruses. So it's actually the bat that is a reservoir of most of this disease. So yes, coronavirus, whether you are a vegan, a vegetarian or not, you are still susceptible. So yes, everyone is susceptible to.
And even once it's shared in the environment and they linger on, let's say, vegetables, a vegan can consume, and if it's not well treated, can get all these.
Exactly.
Yes. Okay. So you've mentioned some examples earlier: anthrax, tuberculosis, and the rest. Are there more examples to be talked about?
Oh yes, definitely. Before I go specifically to the examples, it has been found that about 60 to 85%, the exact number is not actually, they are not stating about the exact number, and then about 60 to 85% of human diseases are zoonotic. So come to think of it, as if it's as low as 60, which is actually high.
That's really
it means like human disease, we are very much susceptible to this disease. So examples of zoonotic disease, as I said earlier, we have anthrax, and one that is very common in our country, rabies. Rabies is
who are the animals involved? Can you tell us? The animals.
Okay. Yes. Okay. Sure. So for the rabies, specifically the dogs, the common one, the common reservoir of rabies is the dog. So we get it from the dog. So as I said earlier, it can be either humans to animals or animals to humans.
Yeah, so but elsewhere too, bats are implicated. Is that right?
Yes, exactly. Yeah. And so we have brucellosis. Yeah. So this one we can get it from the dog, we can get it from cattle. And here, this is actually shared in the milk. Yeah. So yes, those who take milk products and even farmers in the act of milking can get infected. And cysticercosis, so meat products, we get it from consuming specifically pig, the pork. Yes. Wow. So it's accessible to getting that. And trypanosomosis, you see, Ghana, we've been struggling with this sleeping sickness, inhibiting production. Yes. So trypanosomosis also zoonotic. So we get this from and this one tsetsefly. The tsetsefly is implicated in the transmission of the disease. So we have the Ebola virus, which is common to us in Africa. And one common one is salmonella. We also get it. It's also zoonotic. And this salmonellosis actually affects wide area of animals. So wide area of animals. So reptiles, mammals, man, So, and we have ornithosis, the plague, Newcastle disease, and another one that when we hear about it in the news, all of us we are on our tenterhooks, the avian influenza, the influenza viruses. So we have a lot of them.
The list is endless. Yes. I can see if I give you the chance, we are not going to close because
60 to 80%.
So you have a very long list. And interestingly, most of these diseases you are mentioning are very deadly.
Oh yes, they are. Especially Ebola virus.
Ebola.
And for rabies, which is endemic in Ghana, when you get it, as soon as you start showing the clinical signs of the disease, the mortality is 100%.
Wow.
So there's no way out for you. So these diseases are very, very, very important. They are very, very deadly. So
and unfortunately, we tend not to take them seriously.
Yes, that's
like
the point.
Rabies.
Yes, that's the problem you're actually facing in our country today.
And even the world at large.
Yes, exactly.
So these diseases, seeing the dangers involved and the threats they pose, how can one prevent, protect him or herself from getting these diseases?
Okay, so the first thing I would say is hygiene. Hygiene is paramount. So as I said, some of these infectious agents are shared in the environment. So if you are able to keep your environment clean, your personal hygiene, let's say after coming in contact with an animal, you wash your hands and everything, and even your utensils, what you use to prepare our food, you actually clean them very well. Hygiene is paramount in not only zoonotic disease, but many other So hygiene is paramount, and properly cooking of meat or proper handling of meat products. So in our countries or in our world, in our parts of the world, this is actually a preventive measure we do. We normally cook, so to say, overcook our food. So yes,
is that why most people think African germs?
Oh yes. That is just so that's it. Proper cooking of meat and food products from animals, and also one way you can also prevent the transmission or acquisition of such diseases, you can vaccinate yourself. So you can vaccinate, say, let's say for in the case of rabies, you can vaccinate your animals, the dog, that's the dog, which is the reservoir or the common host of the disease. So you can vaccinate it, and it's less expensive than vaccinating the human. So you can vaccinate as well as vaccinating yourself. But if you know you have a pet at home or you're at high risk of acquiring the disease, it will be good to vaccinate yourself. For some of these diseases, we have vaccines available. So those that we have vaccines available, you can vaccinate yourself against as a preventive measure. So,
okay. That's interesting. So, listeners, I think if you are keeping a pet, then you have to take the vaccination schedule very seriously, especially with rabies, as he said. So, I think you've given us much information, more than I even expected. So, is there anything more to add regarding One Health as a concept or zoonotic diseases, as this is about?
Oh, okay. So, the only thing I would like to say is that since these diseases affect almost all of us, we are at risk of getting these diseases, then the onus lies on us, on everyone in society, whether you are a health worker or not, to join hands to eliminate or reduce the occurrence of such diseases in our society. So please, I would advise everyone to do your part. Hygiene, as I said, is paramount, and those who keep animals and proper keeping of animals. In the case of rabies, you will see that I keep on talking about rabies because it's a disease that is 100% preventable through vaccination. But then when you get the disease, the mortality is 100%. So, and it's actually endemic in Ghana. So it's actually, as you say, a disease after my own heart. So yes, something that is so dear to me, that if we are to do what is required of us, vaccinate our animals and properly keep our pets, then there's high chance of eliminating the disease in our country. So yes, zoonotic diseases are very important and cannot be downplayed in our health. In the country, so, and as a developing country, and you can see that these diseases have economic implications. Yes, because they affect both the human resource ourselves as well as the raw materials where we also get from the animals, the milk and other stuff. So yes, let's all join hands in eliminating or reducing the prevalence of such diseases in our country, especially rabies. I keep on talking about rabies. Rabies is 100% preventable. But then when you get a disease, the mortality is 100%. So
I think you would have to be back again and tell us more about these diseases, especially rabies. Sure. It's a disease after your own heart. So, listeners, that is Joachim giving us much information about zoonosis. Now, we will take you to Kumasi and hear from a vet, Dr. Henry Kwadwo Abedu, who is working very hard in the control of rabies. He together with a team of medics, are doing very well in the Ashanti region in trying to control rabies through vaccination.
Hi everyone, I'm Dr. Henry Kwadwo Abedu, a veterinary surgeon, and I'd like to talk to you about rabies and its impact on humans. I am part of the Mission Rabies project, which is ongoing in the Bosomtwe district of the Ashanti region of Ghana, vaccinating dogs against rabies viral disease. This disease is lethal, and when clinical signs manifest, there isn't much to do to help either the human or animal victim. The result, unfortunately, is death. But the good news is that this disease is 100% preventable through vaccinations. For this reason, we set out to vaccinate the dogs in the Bosomtwe district of the Ashanti region through the collaboration of Mission Rabies International, the Veterinary Services Department, and the Ghana Health Services. This One Health collaboration afforded us the opportunity to educate the populace of the Bosomtwe district on the rabies topic, as well as vaccinate the dogs in the vicinity. Rabies is an endemic disease in Ghana and has caused us a lot of losses over the years, which is human life as well as economic losses. For the past 5 years, we've recorded cases of rabies, and upon investigation, we realized that the people whose family members were victims of this disease either didn't know about the disease at all or had limited knowledge concerning the disease. Therefore, it was prudent on our part to educate the public through our veterinary schools and electronic media to sensitize the public concerning this dangerous and lethal disease. We set out to educate the children in the district as well as the adults, and we sent messages through the information centers sensitizing the populace on our arrival in their localities on specific dates to vaccinate the dogs. The response was positive, and we've been able to cover about 80% of the dog population in the Bosomtwe district. The impact of rabies is quite dire on humans. Rabies, as I've already established, is a lethal disease, and when clinical signs manifest, there isn't much to do to help. Therefore, it is very, very important to safeguard the lives of the humans or your family members through vaccinations. And vaccinations, by vaccinating your pets at home, especially the carnivores, especially the dogs, and further on the cats in the house, and protect them against the disease so that they do not transmit it to you as an individual. And through this intervention of Mission Rabies, we've been able to decrease the incidence of rabies in the Bosomtwe district. And we hope that this collaboration can go on in the other regions of Ghana in order to eliminate the disease from the environment. We also educate the general populace to take delight in vaccinating their pets regularly as possible in order to eliminate the disease from the country, because this disease has cost us human lives, children, fathers, mothers, in which these losses have really affected us in diverse ways negatively. Therefore, there is the need to sensitize each and everyone on this disease and this endemicity in our environment, and the need to get rid of the disease through vaccinations. So this evening, this is the little I'd like to share with you on rabies and its impact on humans. And I hope that you go ahead and also inform your friends and family members concerning the disease and the need to vaccinate your pets, especially the dogs, against the disease in order not to get it transmitted to you. Thank you very much for your audience. Bye-bye.
So that was Dr. Henry Kwadwo Abedu, and I think he and his team are doing a good job, and they should keep it up. So back to you, Joachim. Thank you very much for coming.
Welcome. It's actually been a pleasure.
Yeah, we'll be pleased to have you once again, every now and then. In fact, you're a part of this, and this hot seat shall be your home. So our listeners will be having much of you in time to come.
It's actually a privilege.
Okay. So listeners, thank you for making time with us. See you next 2 weeks for another exciting episode. I am Sapon Kumankuma. Bye-bye. It's all we need.
It's all we have.